Unfortunately, sometimes we come across young people that are so seriously unwell, they've been physically compromised and therefore they're in the children's hospital. At that time, there'd be somebody from the Community CAMHS service usually visiting and liaising with the hospital.
Most patients don't have to come into hospital. If a child is admitted, that's usually because they're continuing to lose weight, they're refusing to eat, or they're not drinking.
One of the key reasons why they come into hospital is they become medically compromised, significantly enough to be of concern to their overall health. And that has meant quite a significant deterioration. So coming into hospital can be a very anxious time.
Our aim is to get the child back to a level where they can engage back into the services that were looking after them before, which is the psychiatric outpatient CAMHS service, possibly Riverside. And so we tend to have to concentrate on the physical side of things because we're a medical hospital. So we don't plan to keep the children in the hospital for weeks on end.
So a general monitoring of vital signs, so blood pressure, your respiratory and your temperature. So that's the medical side of it, but we as nurses try and very quickly build a relationship with the young people to help them and make them feel supported.
We have a kind of meal plan that we've devised with the dietitians and the nursing staff and various other people over the years, and we start off on a very low diet regime.
We don't force people to eat at all. What we attempt to do is, with lots of support, enable to eat small portions regularly, so it's not suddenly having a full meal, but slow, frequent snacks building up.
The children that we look after with the anorexia will eat their meals on the beds. So they've got a table and it would be served to the beds. And they're supposed to stay, on the bed for another half an hour afterwards. So that really is to make sure that calories stay down. If they don't eat, we ask them to take a nutritional drink in place of the food. If they can't take the drink, then we actually suggest that needs to go down a tube. But thankfully, most of the time we've managed to avoid that.
So the environment on Ward 35 is very much set to be less clinical feel to it. Whilst there can be some monitoring and equipment around, we've attempted to set the design and the decor up to feel a bit more home from home. We've got a music area with a jukebox in, which is another environment just to step out away from your bed space. This is one of our chill out rooms. Nice comfy sofa, different space. We have a music therapist and we have school teachers.
So this is Ward 35 and you can see it's brightly painted, it's very welcoming. This is a snug, nice big TV screen, music, all state of the art, iPhones, iPod adaptions I'm assuming. Lots of posters about the rights of the teenage children. You can decide to see the doctor on your own. Then the other thing is children and young people, 100% respect. That's the kind of ethos for the medical ward. When you get to a teenager, it's about kind of allowing you and helping you understand about your illness and the responsibility that you take, rather than relying totally on your parents. And I think that's very important.